When I would drive outside the plantation or the development, I would pick up people who were walking alongside the road and give them a lift to wherever they were going, back to their house or to work site. And I invariably asked them where they got their health care, and they invariably said, I don't get any. That to me was unbelievable. Well, we had two problems. We had the problem of those who had no access to health care, and we had the problem of those who lived on the island who had no easy way to deliver it. So I brought those two problems together, and I made a solution out of it, which we call the Volunteers in Medicine Clinic. And now I'm told now that every person that lives in our town has access to health care, and we are the only town in the nation that can declare that.
We started out in a very small environment. The hospital donated a little space to us, and when we first started, all we did was immunization for children, and we only had nurses, and then it started building from there. We needed the support of the local newspaper because the more they would write about what we were trying to accomplish, the more people would come through the door and present themselves.
And based on two mottos, the Golden Rule and the Second Commandment, it was a very simple but powerful conclusion that we came to, and that was, we do not want to perceive them as patients, diseases or illnesses. We want to perceive them as friends and neighbors who don't feel well and are coming over to us for help.
We have people, all kinds of people young, old, every nationality, and some that are very, very ill, some that are just in for a checkup or come into the dentist.
And we do need this. You'll be surprised so many people just sick and don't have the money, and they don't go because they don't have the money.
If the clinic wasn't here, honestly, I don't know what I'd do.
There's no other place to get it that I've been able to find, especially when you have specialized problems like ADHD, psychiatric problems, and this clinic handles all of that.
Volunteers in Medicine accepts no fees. We're open to donations, but patients are not required to pay for their treatment.
Hello, welcome.
When they arrive at the door, they're not perceived as a patient. They're perceived as a friend and a neighbor. And then someone greets them. You know, if someone came to your house, you wouldn't stand inside your living room and wait for them to come inside your living room before you say hello. We go to the door to greet them. And there's a greeter there. And that greeter's responsibility is to say something along the lines, how sorry we are you don't feel well, but how pleased we are you came to this clinic, because this is your clinic. Come in, let's see if we can help you.
And then we are really their advocate. We are the ones that are supposed to, if they're not seen in a half an hour, in 10 minutes, whatever time, we go back and check with the nursing station and find out where they are and how they can move them along a little faster.
Dr. McConnell is a unique person to work with. He's always looking for the next need out there in the community. So while he was working diligently on the clinic, he was also thinking about how he could transpose this to help other communities.
We have 41 million without health insurance that are medically underserved, and they're scattered through every state, every city, every town, and every village in the United States.
Yes, there is a need for a clinic like this in this community, and it should be in every community.
Dental clinic in particular, there are kids who would never go to a dentist if they couldn't come here.
Especially dental education. And this clinic has reached a lot of people.
Or sometimes people just need somebody to talk to and be supportive.
We're not rushed to see patients. We don't have to see a patient every 12 minutes in order to make the budget. If we have to take 20, 30, 40 minutes time, that's okay. It's quite all right.
It's very relaxed, and it gives you a chance to meet a great many people. The people you work with are very stimulating as well, because there isn't anyone working at Volunteers in Medicine that isn't a very interesting person on their own.
It's very affirming to practice in a setting where so many people are interested in helping out.
Good morning. It's enjoyable, really, even though it's tiring some days when we're very busy.
It is a very relaxed and a very comfortable relationship that we have with those that come here for care.
I think it's important that each community should have a clinic like this because there are people out there that just can't afford the medical bills.
I just can't see every community not having a center like this. This is, it's a blessing.
As the saying goes, you have to give something back sometime.
I think that any community that takes this on is taking on something that will give them greater personal satisfaction if you're working with it, and certainly benefit to the community, way beyond whatever you may measure or survey or anything else.
And the beauty of this is that when you bring those two elements together, you create something wonderful, beautiful and wonderful out of it. And to be a part of it is one of the most exciting things that one could ever experience in their lives.
Loves it. Don't you, honey?
Those people who entered medicine because it was a calling rather than a job or profession are the ones that I think have the most satisfaction and probably fit in the best here.
I feel like in this life that you can't just be a taker, you have to give.
If you would see the gratitude that we receive from patients, from the care that we're giving them, there is no money in the whole wide world that could buy that kind of pleasantness and that kind of pleasure with.
Everybody in the clinic works to make sure that all of our patients feel welcome and cared for.
It's very rewarding.
Yeah, that's right.
I think every community has a Dr. McConnell. They just have to discover it. And I think within every person who's a caring person is a piece of Dr. McConnell. It's just how we can help them to transfer that need and desire into a reality.
I don't think I ever spent two minutes worrying about whether or not this clinic was going to occur. What we're going to do is to take these plans. When I realized the magnitude of the need and the depth of it, I couldn't do otherwise. And having done otherwise, having done it, having been involved in it and created it, it's not fun. It's something deeper and more enriching than that. It's joy at its deepest level. May we have eyes to see those who have been rendered invisible and excluded. Open arms and hearts to reach out and include them. Healing hands to touch their lives with love. And in the process, heal ourselves.